Any more questions? I haven't read the chat, so maybe I should have a look on this. Or Jenny, do you follow for
there's nothing else on the chat, I don't think.
Okay.
Yeah.
So yes, we then can move on to the last lecture. It's Professor Zhou, a friend of mine, one of my teacher. So now the teacher, hi. So Professor Quinn is he's from Second Affiliated Hospital of Chongqing Medical University, and he's an associate professor. And his clinical applications of high-intensity focused ultrasound, clinical oncology, and basic and clinical research of HIFU. In 2020, he awarded the, I don't know how to pronounce correctly, Quanwen Talents Program of the Second Affiliated Hospital of Chongqing Medical University. So Quinn, I'm very interested in your video. I think you will show a video about surgery Video-HIFU treatment for pancreatic cancer. Please go ahead.
Thank you, Mr. Chair, Professor Kristen and Professor Strong. Thank you, everyone. And now in China, it's very late. It's 9:30 p.m. So I will try my best to speed up. Well, can you see the PPT here?
Yes, great.
Okay. So our hospital was founded almost 130 years ago. So this is the historic picture of our hospital. And this is the HIFU team of us, the Second Affiliated Hospital of Chongqing Medical University. Well, also the national training base for HIFU treatment was founded in our hospital since September 2005. It's over almost over 15 years. During last 20 years, there are over 500 doctors trained in our center. They are from 120 clinics or hospitals or university. See these pictures? Well, personally, I have the experience of HIFU treatment for the tumors or the lesions or the diseases from the head and to the chest wall, metastasis on the chest wall, in breast cancer, in liver, in pancreas, in kidney. This case from Pisa, Professor Candio. And uterus. Also happened on the legs, adrenal glands, and the bones. Inside the abdominal wall, and even on the bottom of the feet. So we can see the candidates for HIFU treatment could be from head to feet. So as we all know, the heat delivered by the ultrasound could ablate or treat those solid tumors. Also, we have the two clinical guidelines in China. The first one was published in 2005, and the second was published last year. Also, we have another guidelines in the Fudan University Shanghai Cancer Center. So here in China, we can gather the evidences and the experience of HIFU treatment for pancreatic cancer. This article was from Fudan University Shanghai Cancer Center. It including over 400 cases accepted HIFU treatment And it was found that the HIFU treatment provide the survival benefits for the patient. Also, the experience from the surgeon leads us to that if we perform the HIFU treatment as a pre-operative treatment before opening surgery for those patients with borderline resectable pancreatic cancer, it is possible to improve the possibility of the R0 or R1 resection. So compared with those patients accepted RT radiation therapy, this data from MD Anderson Cancer Center, it was only around 40%. That means the HIFU treatment probably provide a better opportunity for patients with the borderline resectable pancreatic cancer to accept the future R0 resection. Also, we found that if we perform the HIFU plus chemo together, that means a local HIFU ablation plus a systemic medicine therapy, it will give more longer survival for the patients. So in our center, at the very beginning, it was just a palliative treatment. The first, the initial target from us, it is just a local and partial ablation for the patient, and or try to control or release the pain. But during these years, we found that there are evidences of benefits for survival and benefits for the pain control or release, and the benefit to improve the quality of life for this patient with pancreatic cancer. Well, I have to quit to the video. Is it clear? This is the operation room in our center. We can see the patient table is on the center of the room.
Quinn, you are back to the whatever mode, but we don't see the video.
I will quit and
okay.
One.
Just to let you know. Okay, now it's the video.
Okay, again, start. So this is the HIFU room of our center. We can say the patient table is in the center of the room. The patient is in prone position. Well, here, we can stop here. We can see this is a metal frame here, and with the pillow belt to hold the patient here and closer. Okay, stop here. There is a point that I want to emphasize that with the prone position, we should make sure the free of the joints here. The shoulder and the elbow joints there. We say that all joints free during the HIFU treatment because the ultrasound guided HIFU treatment is from the lower part. Transducer is inside this tank. The transducer is here. So the therapeutic ultrasound is from the lower part to the upper part, from this direction, from lower to upper. So that for this patient, it is in prone position, we should make sure all the joints free, all joints free to and to avoid such the muscle or the nerve injury during the treatment. Well, go on. And then this patient is under the general anesthesia. See here, the shoulder, the elbow, the joints free. Well, it's under general anesthesia, and the Professor Yonghua Xu said it is possible to perform the HIFU treatment for pancreatic cancer under sedation. Yes, it is. In our center, the ratio is about 2 to 1. 2 patients with pancreatic cancer accepted general anesthesia. The one accepted deep sedation. It depends on the situation for the patients and the purpose of our operation. Yeah. Well, this is the chief doctor for this operation. This is the workshop, say here. And this is ultrasound image, the real-time monitoring beam mode ultrasound. And this one is the image before treatment with the image helped real-time ultrasound guided therapy. It is possible to find all the details during treatment. Well, let's go back to the PPT again. Here, I would like to share a video during from one case. Here, we can see the right part is the patient. The tumor is on the body of the pancreas, and it invade the blood vessels was included by the tumor from here. See, this is spine, and this is aorta, and this is celiac trunk here. This is the body of the pancreas, and we can see the tumor is here. This video is before treatment. Okay, let's see it. It's under the CUS, the contrast enhanced ultrasound image with the solar view injection. We can see here enhancement here. So the microbubble enters to the blood vessels first, and the less bubble enters to the tumor. So generally speaking, the pancreatic cancer is a poor blood supply tumor. See, the aorta, strong enhanced, but the tumor was poorly enhanced. Well, let's jump to the treatment here. Let's say the hypoxic change will happen here. The same precision, the therapeutic, the invisible ultrasound from the lower part, from the transducer here, and focused on here. Each solicitation got a hypoxic change. We call this a massive gray scale change. It's larger and larger. Okay, speed up. Another point here. Another massive critical change. So with these solutions, one dot by one dot, we will place the focus for where we want to treat or where we want to ablate, and finally complete the treatment plan. Well, after that, we perform another CUS with solo view, again to see what happened to the tumor. Almost no enhancement happened here. Well, this is the videos. Well, another case is here, just treated last week. This case, this gentleman was diagnosed on this May. There was pain happened on the belly and the back. The C99 is over 1,000. So after diagnosis, the chemotherapy was performed 6 months. The C99, it was 500 on 1 month ago, and here the tumor size was smaller than the very beginning. And yesterday, the rescan after hysterectomy, we see that the tumor was ablated successfully, and the C99 is only 265. This case was 2 hours ago. We accepted this lady. It was a very huge one with calcification inside, and even with a blood vessel. This is SMA here, a blood vessel here. So after treatment, we can say that it was almost complete ablated, and the blood vessel was safe, no any change. It's here. So generally speaking, we believe that based on the clinical reports and from our experiences, we believe that first, the HIFU treatment will benefit patients with pancreatic cancer for survival. So far, we found that the median survival time was 12 to 24 months. The second one is that it will help us, doctors, to control or release the cancer-related pain for those patients. The third is that it is possible to be a pre-surgery for borderline resectable ones. I believe the surgeons will like this idea to use this non-invasive treatment to help them to change the stage of the patient and perform a R0 resection for pancreatic cancer. Also, there is strong evidence that the HIFU treatment will improve the quality of life for patients with pancreatic cancer. So finally, we believe it is a safe and a minimal invasive treatment. Well, this is what I want to share you. Thank you. And dank and grazie. Thanks.